What's up, friends? Welcome back to KimmyDTV, tips and tricks living your best life. In this video, I'm going to be talking about how to complete the task of taking care of your narcotics, both administering, preparing it, and when you receive the keys to start before you start your shift, so that you guard your license. Because you guys know in nursing school, or if you're in nursing school already, you're gonna always hear that narcotics is your license, and it's true. That's where your license lies. So this November will make me 7 years in LPN, I believe. So I've been able to keep my license for 7 years by the grace of God, because I know how to take care of my narcotics, different ways of how to perform my job efficiently, but of course make sure that my narcotics is safe. So this video is going to be basically narcotics 101. So if you're interested in it, sit back, grab a snack, and enjoy the show. Okay, let's go. So the first tip I would say when it comes to your narcotics is make sure that you have 2 people counting at the same time. Now, what do I mean by that? So as an LPN, when I start my shift, after I do my rounds, the first thing I do is I count narcotics with the previous nurse. So I'm oncoming and the nurse is leaving. So make sure you have 2 people counting narcotics. Some facilities, you count the narcotics inside the medication room. Some facilities, you count the narcotics out in the open. I've been to both, but whatever the situation may be, make sure you count it with 2 nurses. I know it's easier said than done. A lot of nurses, I know some of them, they do not count with another nurse. You could trust somebody and be like, oh well, I noticed my friend, like, you could leave, like they would say. Or if a nurse comes late, they were like, oh, you could leave because I know my narcotics are good because I worked with this person before. No, don't do that at all. Don't trust anybody with your narcotics, because guess what? When you were going to nursing school, when you were taking your boards, when you were studying so hard, all those sleepless nights, we know as nursing students, they weren't there with you, okay? So you have to guard your license, and even if they're your friend, yeah, you never know, people, make sure you count your narcotics. I'll give you an example. There was a story about a girl, she actually trusted another nurse. She was like, oh, you don't have to count with me. So basically the girl was coming in, right, and the other nurse was leaving, but the other nurse, I guess she had to like clean up the cart or whatever, and the girl coming in was like, that's okay, I'll count the narcotics by myself and I'll let you know if there's any discrepancies. So little did she know that there was actually a pill missing. So she calls the other nurse, she's like, hey, there's a pill missing, and the nurse was like, well, I don't know where it went. So long story short, the nurse who was coming in, she went to report to the supervisor. The supervisor said, well, you know, in theory, in essence, you would be the one who would be in trouble for that, because you know you're supposed to count with 2 people, and the last person seen with this medication was you, because you decided to come in and count. You took the keys. That's another thing. Don't ever take the keys until those... Don't ever take, and when I say keys, I mean your medication card keys. Don't ever take your medication card keys until your narcotics are counted. That is number 1 after making your rounds, okay? You don't accept a dead patient, and you don't accept any narcotics that are missing, because that's going to be on you. And honestly, guys, it's not just about your license, it's about your life, because if anything, the DEA will come in. I think that's called the DEA, the drug enforcement people, you know. They will come in and they will, you know, search, and that's not just your license, that's your life, you know. Best believe people can get arrested for missing narcotics and stuff like that. So basically, long story short, both of the nurses were looking around, and then all of a sudden, the nurse who was leaving, she said, hey, I just found a pill. And the nurse coming in says, well, where did you find it? And the nurse who was leaving said, well, I just found it in the cart, just right here in the top shelf. And then when the nurse was describing to me the story, she was like, well, that's kind of weird, because I looked in the top shelf too. You see what I mean? So she probably was trying to take it, you know? And you know, there are people who, even if they're nurses, okay, even if they were smart enough to pass nursing school or whatever, there are people who can abuse drugs, you know, and there are people who can sell drugs. You know, this is a real thing. This is a real business. Think about, oh, that could be my side hustle. I used to think that that could never happen, but to see what I've seen, it's possible, okay? People could take drugs maybe to ruin you, or to sell drugs, or to take them themselves. So best believe, please count with 2 people. Do not trust anybody. If they make a fuss about it, then you call the supervisor downstairs. Even if you're late, the person's late, it's better that you count it than you ruin your license and you ruin your life. The thing is, when you're administering narcotics, make sure you watch for names that look the same, but it's not the same. Like for example, morphine and hydromorphone, like they sound the same. Like, correct me if I'm wrong, but I'm just giving you an example off the top of my head, right? I could be even pronouncing them wrong. They sound the same, but they are 2 different things, okay? One of them is 10 times stronger than the other. So if you pop one medication and you give it to the patient and they're not supposed to do it, what if they're not supposed to have it? What if they have an allergic reaction to it? But better yet, if you pop from the hydromorphone and you were really supposed to give oxycodone, then they're gonna ask you, well, where's that medication? That's a medication error, and that's reportable by state. So make sure you watch for names. Like, especially when you work in the psych unit, you will see a lot of medications that look the same. But open your eyes. Some places they will be nice enough to underline or whatever, but sometimes nurses don't have time. They just accept the narcotics and be about their merry way. Make sure you open your eyes and you look. And if you're the person accepting a new batch of narcotics, like usually if you're working on the floor, whatever shift, if you're supposed to receive new narcotics from the pharmacy, the supervisor would come up. But some states, I know the pharmacist comes up, or the pharmacy tech, or whoever delivering it. Make sure you look at it. That brings me to another point. When somebody is bringing you medication, the person who is bringing it to you, I don't care if they're in a rush, make sure that they do not leave until you look at it. So if the paper says they gave you oxycodone 60 milligrams, when you sign their little machine or you sign a little paper, you're saying that you received it from that carrier, that it was oxycodone 60 tablets in that packet, in that blister pack or whatever. So actually make sure what you see is there. If they get annoyed because you take too long, oh well, like I said, it's your license. Like, at the end of the day, that guy or that girl who delivered it, they're making their money, so you have to make sure you make your money, right? So make sure that it is correct. And I can't tell you how many times I've seen that too, especially in my travel nursing journey, where a nurse was accepting a medication, and then after a while they went to give medication to a patient, they didn't have it, and then they called the pharmacy, and the pharmacy's like, well, you signed that you accepted it. You know, you don't want to be in that position, because then the state is involved in everything. So don't be in that position. Take your time to count it when somebody brings the medication for you. And not only do you watch the names, you watch the milligrams, especially on the psych unit. Any unit where you work and there's like a lot of narcotics, which I hate, make sure you watch the milligrams. It could be as different as, oh, like for example, patient Jamie can have at 10 a.m. she could have an oxycodone 2 milligram and an oxycodone 8 milligram at the same time, you know. But you have to make sure you're popping from the right milligram. It could look exactly the same, but the milligram may be different, and or in the evening she gets that, in the afternoon she gets that. So make sure you guys are really paying attention. And another tip is that when it comes to something like methadone, some people can make the mistake of, so if you work in a facility where they give methadone the liquid version and methadone the tablet version, make sure that if it says methadone is due, that you're not giving the liquid when it's actually the tablet that's due. That's also reportable to state. So that's what I'm saying. You have to look. Is it methadone the liquid version or methadone the tablet version? Methadone, for some reason, a lot of nurses make mistakes with methadone. Sometimes they have like a whole stock of methadone that people take from and that stock of methadone is not really belonging to one particular patient. It's just like a stock, but you just have to know if it's liquid. And also with the methadone cups, a lot of the times with the methadone cups, facilities do not want you to throw away the methadone cups. They want you to keep it in the narcotic box so that you could prove that the patient drank that whole methadone. So when the patient is drinking that methadone, if they want to put water in it to drink it, I remember one time I was administering methadone, the liquid one, and the patient was like, after she consumed it, she was like, oh no, she wants to put some water to make sure she gets every last drop, and that's fine, but don't throw it away, because they can say, oh, you drank it or whatever. So make sure they sign. And also, I know when you take methadone, they have to sign, so make sure they sign before you give it to them, because they could be like, oh, I'm taking it and I'm not signing it because I want an extra one or something, you know. But usually that doesn't happen. I have not encountered that, thank God. Usually they're pretty honest about that, but yeah, make sure you do that. That brings me to another point. If you could be strict about reordering medications, it has to be your narcotics, because there are patients, like I said, those who are, you know, dependent on methadone, or those who are in extreme pain. They do not play when it comes to getting their narcotics. So if you are the nurse, and I know everybody is like, but if you are the nurse, please reorder the medication if you see only 2 left. Please reorder the medication if you see only 1 left. There are some nurses, even if you're working agency, I've always worked agency, there are some nurses, like, they see 1 left, 1 oxycodone, and they don't care. They will not reorder it. That's not fair. It may not be your floor, but come on now, like, you know the patient is going to really be agitated if they don't get it. So just reorder the medication, make life easier. Usually if you run out of medication, out of the pain medicine or whatever narcotic that you need, you would have to go downstairs to the nursing office, sign for this, sign for that. Then the RN has to take it out of her stock medicine, and then like all that, waste your time with all of the other patients and with that patient, and that patient's gonna get angry. So guys, reorder the medication, and when you're counting it, like, notice things. Say, oh, he doesn't have more of his oxycodone, well, he's gonna need one for that shift. Like, hold that other nurse accountable. Ask her, like, well, where's the other ones, you know? I'm not saying argue with people, but just keep an eye so that you can, like, if you have a little time before your shift, you can take it real quick and make sure that you order it. So maybe by the time you get to that patient, that medication will be here. Like, hopefully that's that. Another thing is that when you're accepting your medication card, make sure that you check inside the medication card to make sure there's no medication inside a little cup, because some nurses could leave, like, some nurses could even forget to give a narcotic, and they could leave it inside the medication cart. And then if you're working and pharmacy comes up, or whoever comes up to come check your cart, and they see a narcotic in there, it has been done, okay? These things do happen. I'm not just making up stuff. That's what I'm saying. Make sure you check your medication cart, especially the top drawer. You know, when people save medication, do not accept any medication inside any cup. Do not give any medication for any nurse. A nurse would be like, oh, you know, I had a long day, I had so many patients to give, I had this to do, I had that to do, can you just give this medication real quick? Especially if it's a narcotic, do not give it. You can get in trouble. I've seen it done. It's not just something I'm reading because I went to nursing school or I read an article or whatever, but make sure that you're really watching your narcotics, okay? And also, when it comes to not accepting medications inside that cart, don't pre-pop narcotics. Oh my gosh, you shouldn't pre-pop medications, period. But if you're one of those nurses, and I know there's nurses out there who do it, just do not pre-pop narcotics. Let me tell you something why. Because if you pre-pop a narcotic and that patient's like, you know what, they don't feel like taking this pain medicine, now what you gonna do? You know? Back in the day, they used to take the pill and put it back in the blister pack and just put a tape over it. Now state doesn't want that anymore, okay? The state board of nursing doesn't want that anymore. So you're gonna have to waste it. You're gonna have to call the supervisor and waste it together. And that's all taking your time from the patients that you have to give their medication to. So in my opinion, do not pre-pop narcotics, okay? Even if you have a million medications to give. You could have 70, 80, 100 patients to give medication to. You could be so annoyed. This could be your worst day. This could be your worst day in your job. Do not just give out narcotics. You have to sign it out. That's one thing I always do, no matter what. Even if you sign near the blister pack, when you give a narcotic, sign it out. When you give a narcotic, sign it out. Take that time. And I feel like that's why I held my license for so long, because every time I gave a narcotic, I made sure that I signed it out, because I know that's my license, and I know I don't want a patient to come tell me, oh, you didn't give. Sometimes a patient forget too. They like, oh, you didn't give me this. I said, oh, let me check my book, because sometimes I'm being pulled in several different directions. People are calling me there. They don't really care if you're giving medication. They don't really care if it's narcotics. But guess what? I care. But if I wrote it down, then I know that I gave it, you know. So, and make sure you write down the time, especially if the patient is on a PRN. Pain medicine is every 4 hours, every 8 hours. Some patients can be like, no, I didn't get it, but you're counting the time, all right? So that's another thing with pain medicine. Make sure you look at the time, every 4, every 8. Don't let them bully you into giving medication at any time. If they need it sooner, you call a doctor and you follow that policy. But make sure you write down the time that you're giving it, especially when it comes to pain medicine that is scheduled every 8 hours, every 4 hours. You know what I mean? Another thing is, when I did travel nursing, I had a Pyxis machine, and basically it was a machine where you had to take the narcotics or any other medication really. You had to put your ID or something with your finger or whatever. Make sure people who, like, especially live in Texas, you guys know what I'm talking about. Count every single pill in that roll, because if you put in the wrong thing, they're gonna track you, because it's only you that goes in there. They're gonna track you and they're gonna be like, where is this medication? So make sure you count every single packet. It could be tedious and time consuming, but make sure you count every single packet and make sure all of them are in, and then you insert it and then you take it. Okay, those of you guys who have a Pyxis, you guys understand it, but Pyxis is more like, they really watch you, okay, and they could see who was the last person there, who was this. So there's no monkey business with the Pyxis. So that's all the tips I could think about when it comes to narcotics 101. I hope these tips help you. If there are any other nurses who have tips when it comes to narcotics, don't forget to leave it in the comments down below, because we all need to know how to guard our narcotics. Basically Narcotics 101, we all need a lesson on that, because that is our license, that is our life, okay? Not only our license, our life. So thank you guys so much for watching. I'll see you guys later. Bye.